Hello, my name is David Clark, and I'm here to do my oral presentation for case assignment number 2 for course BHS 414 Cross-Cultural Health Perspectives. Cultural identity. In case number 2, we get to watch 2 videos from the University of Michigan School of Dentistry to help illustrate effective and non-effective ways of communicating with patients from different cultures and answer 3 questions regarding these videos. In this talk, we will concentrate on the first video where Dr. Kent is interviewing Mr. Chan, a 70-year-old patient who comes in presenting with bleeding gums and bad breath. He had tried traditional Chinese herbal medicine, but they had not worked. His sister had pushed him to see an American doctor to see what can be done. He believes the root cause of all of this is his weak liver. Question number 1. In terms of communicating with patients in different cultures, what did the health professionals in this video clips do well? The doctor properly introduced herself. She sat down at eye level and made good eye contact with her patient. She showed genuine care and concern for the patient. The doctor inquired about the treatments Mr. Chan had tried and their effectiveness. The doctor inquires about treatment. The doctor repeats back to the patient what she has heard him say to make sure that she fully understood exactly what the problem is and is accepting of his view of the situation. The doctor explains some of the similarities between Eastern and Western medicine and offers the use of best of both to help Mr. Chan. The doctor elicits patient's inputs and talks through his concerns, empathizing with him and promising to do her best to get through the illness. Finally, the doctor asked for permission to examine him. Question number 2. To what extent do you think cultural beliefs, values, and traditions may impact health, education efforts? Provide examples of negative and positive impacts to apply case studies from the video. Positive impacts. Mutual cultural understanding. A chance to develop trust and appreciation for each culture and culture's handle of healthcare. A chance to learn from one another. Each culture brings value to healthcare. We can also show our similarities in medicine as a way to point out that we're not too different from one another after all. Dialogue. I believe this is the most important of all. Through dialogue, we can set up protocols and training to help staff to effectively understand the community they were here trying to treat. Negative impacts. Mistrust. From mistrust, patients won't come in to see the doctors to get medical help needed. Needless pain and suffering. Because patients may not seek out Western medical help, their children or themselves could be suffering needlessly. Question number 3. Based on the video, what would you suggest to health professionals who want to improve their cross-cultural communication skills with clients or patients? First, learn about the culture, traditions of patients you care for. Pay close attention to body language, lack of response, and expressions of anxiety that may signal that the patient or family is in conflict but perhaps hesitant to tell you. Ask the patient and family open-ended questions to gain more information about their assumptions and expectations. Remain non-judgmental. When given information that reflects values that differ from yours. Finally, follow your advice given by patients about appropriate ways to facilitate communications within families and between families and other healthcare providers. Thank you for taking time to watch my video. I hope you enjoyed it. References will be available in my written report that I'll be uploading along with this video. Goodbye.